Here in the clinic we also use 3D digital imaging to assess patients for breast augmentation procedures. We have a Vectra which allows us to capture some data that we can manipulate and use in assessing a patient, and also assist us in choosing an appropriate implant for the patient. It's a very good way of getting a realistic idea of post-operative outcomes. So we position our patient in front of the Vectra like this, positions right, just pop your arms out at 45 degrees there, and we have the patient in position. We just take our image capture. So once we've captured the data using the 3D image capture device here, we can import it into the software in the computer, and using the breast augmentation module for the Vectra software, we can use that to give the patient an idea of a realistic outcome for her surgery. So this is the image we get with the data capture from the 3D image capture device, and we can rotate the image to assess. You can see it's very lifelike. We can look at various views, and we can actually manipulate the data like this so that we can actually sort of look from all angles, and you can see that we've got good symmetry here. Now I can also open the breast augmentation module, which will automatically place landmarks, and again we can rotate the picture just to double check where all these landmarks are sitting, and you can see that everything's where it needs to be. Once I've done this, we can assess all the data that we've looked at. As you can see, we're quite symmetrical here, and it gives us a good indication of breast width, which just corresponds with the information we had when we were examining the patient. And from here we can look at a whole range of different parameters, but I'm just going to move on to selecting implants. Now the computer will actually give some recommendations for implants. We already have a fairly good idea about the sort of implant that we want to use in terms of shape. We're going to use a shaped implant, as I have said earlier. Now we're looking for an implant in this patient which is going to be a moderate height, probably a full projection implant, and you can see down here we've got MF, which stands for moderate height full projection, and she wanted an implant around about 250 to 300 cc. So all of these implants that are highlighted in yellow here are the ones that the computer thinks are the right size, and this one here corresponds, as does this one here. So we can actually put two scenarios in place. So I'm going to try both the 295 and the 255 cc moderate height full projection implants, and then we can move on to viewing the results, which that's doing for us, and we can look at several views. I'll just like to do a side-by-side view, and in fact I'll put up all three choices, which is that's done here. So here we see a screen which is showing a simulated result. This is before, and this is after using our 295, and this is after using our 255. So it gives us quite a good realistic idea about the sort of outcome we could expect using those various implants. And I can show this to the patient, and the patient can give us an idea of what their preferred result is based on that. So we can try many different implants for the patient to see what sort of result they might be able to expect. This has been a great help to us in terms of giving the patient a realistic idea of their probable outcome with the kind of implant they're choosing.